Hi, I'm Dr. Morris, and today I want to talk about something a lot of patients ask me about: dental crowns and when you might need one. A tooth that is very badly decayed, excessively worn down, or cracked may need more than just a filling. A dental crown works like a protective cap, sitting snugly over the tooth to bring back its original shape and strength. A dental crown is also commonly recommended after a root canal, since the tooth tends to be a bit more brittle once the root canal treatment is completed. Crowns are also useful for teeth that have cracked from years of chewing or grinding. As long as the foundation of the tooth is still healthy, a crown is often a better option than removing the tooth altogether. Once a crown is placed, you'll be able to chew down and bite without worrying about your tooth breaking further. Your dentist can check during your visit whether a dental crown is the right solution for your specific tooth.